Somali government has reported a surge in cholera cases across the country following intense flooding caused by El Nino rains late last year. According to the Ministry of Health and Human Services, 21 flood-affected districts are reporting cholera cases. Over 2,500 new cholera cases and 23 deaths have been reported since January, with more than half of these cases classified as severe. Children under 5 years of age accounted for 62% of the reported cases. According to the World Health Organization, Somalia has had uninterrupted cholera transmission since 2022. Let's get more now from Mohamed Kahie. He is live for us in Mogadishu. So Kahie, what is the situation on the ground?
Well, Penina, according to Somalia's Ministry of Health, the cholera outbreak which was reported in the country in January earlier this year is surging, and so far, according to the latest data released by the Ministry of Health, more than 2,500 cases have been documented and about 23 fatalities have been reported since January. Well, the Ministry of Health says that the cases are still spreading and rampant in areas that were impacted by the El Nino weather phenomenon, which is most part of the southern part of the country, in regions like Hiran, in Lower Shabelle region, and in Jubaland. And most of these cases are resulted by the flooding, and health authorities say that the water is contaminated due to the flooding of the river, and they're trying their best to control these cases. Most of the people impacted by this are the children under the age of 5 years old and women, most of them living in IDP camps that were displaced by the water, and some of them conflict, and even previously the drought situation. So the situation right now is spreading, and the authorities are saying that they're trying their best to control this latest health crisis in Somalia, which was already facing other crises such as drought and also weather and climate change.
Okay, so let's talk about that, Kahie, government's response to this crisis. What is government doing, and as well the partners, to help minimize the spread?
Well, yes, the authorities, together with its international partners such as World Health Organizations, are saying that they are taking mitigation efforts to try to limit this spread, especially in areas that right now are reported. They're saying that they're impact on civic education and also preventive measures, and also by providing, cleaning water cleaning detergents to try and clean the water. But the biggest challenge here is that the health facilities in those areas are not, most of them, capable to deal with these rising cases. And that is what the government right now is trying to focus with its international partners by some cases setting up makeshift health centers in remote areas where most of the fatalities have been reported. So the authorities, together with international partners, are now busy. But of course, Somalia has been facing a lot of crises like drought and also, this conflict, and most of the financial resources have been diverted to that areas. So this latest crisis also needs a lot of resources, and that's what the authorities are now focusing on.
All right, thank you very much for that update, Mohamed Kahie, live in Mogadishu.